different jobs that I've had, you know, dealing with 3 kids, a single mom. I couldn't afford health insurance. And your kids need health insurance, dental, medical, vision. Thank goodness for Medicaid, really, because I couldn't afford that.
Medicaid, it's not just processing an application and giving somebody a plastic card. It's the health care delivery that's on the other end of that plastic card that's important.
Nationally, we still have about 4.3 million children who are eligible for Medicaid or CHIP but are not enrolled. That's 4.3 million children that we're talking about affecting their lives. Maximizing enrollment, our overall goal is to get kids who are eligible enrolled. The work that we're doing is really a testament to how any state, if it's got the commitment to the goal, can actually make a lot of progress. 8 states were selected by the Robert Wood Johnson Foundation based on the commitment of the state to really think differently and redesign how things work.
Louisiana is a fairly poor southern state. Our enrollment is over 25% of our state population, but it's primarily children. The slump in the national economy has certainly been a challenge for everyone. We've had a significant increase in enrollment. We should be seeing significant stresses within the system, and that really hasn't happened because Max Enrolled helped us in reforming the system.
Good afternoon, how are you?
We implemented CHIP in 1998. We had made significant progress in traditional outreach and enrollment initiatives. We engage people in the community where they are. But when it came time for renewal, we were losing lots of those children. As a matter of fact, we were losing more children at renewal than we were bringing in with new enrollment. Our renewal process was so burdensome for the families that they simply weren't bothering to renew. And so we deliberately set about streamlining our renewal process to make sure that they don't drop through the cracks. The first thing that we did was really focus on renewal notices for a subset of our population. Their situation was very, very stable, and they were renewed each year. And so we automated that. And that freed up about 160 eligibility workers to do other things.
Now, because some of the renewals have become automated, we can spend more time locating those clients that we do have to contact. It doesn't mean just call a phone number 3 times. Try different things. Go back through old applications. Really do a lot of tracking down.
Your 2 months postpartum ends at the end of this month. I was calling to renew you. You might be eligible for the LICE program that's for the low-income family with children.
Max Enrolled helped us take it to the next level. We took our closure rate at renewal, which represented more than 10,000 children per month, down to about 325 children. It was the turning point, if you will, in our redesign of our eligibility processes. We had one of those aha moments. We knew there was a hardcore 5% of children that we still had not reached.
You ready for that food stamp card?
A large percentage of them were between 50 and 100% of poverty, fairly deep poverty.
Okay, I got it.
Traditional outreach techniques were not going to help us get there. We knew we needed to do something radically different.
Next.
Max Enrolled helped us to learn how to do express lane eligibility.
Express lane eligibility is using other state agencies' information to determine eligibility for Medicaid. People apply for food stamps, and in turn, they get the Medicaid benefits immediately. That has added thousands and thousands of children to our Medicaid rolls. When you're an analyst, you're frontline. You know, it's part social work. You talk to people every day, you hear their stories, and you realize how much they are in need. There's a really good feeling when you're able to help someone.
Just to know that you can bring your child without being turned away from not having any insurance is great. My son, he was able to get treated. My daughter, she has to get eyeglasses this year. It's good to know that, you know, my kids are insured.
Some of the things that we've initiated through funding that Robert Wood Johnson Foundation has made available have resulted in substantial savings, almost a $19 million cost savings in my administrative budget. A dozen years ago, 1 in 3 eligible children in this state were uninsured, and now less than 5% are.
One of the most important things about Louisiana is they're always looking for ways to do things better. There's incredible opportunities for states to improve things, and that's what we are here for.